The aggregate we chose are senior citizens 65 years old and up living in the 89101 region of Las Vegas, Nevada. There are 46,000 individuals that live in the 89101 region. Senior citizens 65 and up only make up 13% of the population at 3,400, in comparison to the 13,000 population of 35 to 49-year-olds or the 11,000 20 to 34-year-olds. Male population is slightly higher than female population at 50.1%. The Hispanic Latino community make up the largest portion of the 89101 region at 58.6%, followed by African Americans at 43% and Asians at 28%. As of August 5th, 2020, there are a total of 1,335 COVID-19 cases in 89101, making it one of the communities with the highest incidences of COVID-19. Individuals in Las Vegas seem to make less money than those in other states in the U.S. on average. The Las Vegas metro area has a weekly wage of $1,005, compared to the average weekly salary of $1,185 for the entire U.S. Mean hourly wage in Las Vegas is $22.43, $3 less than the mean hourly wage in the U.S. Poverty rate in the Las Vegas Valley is also at 15.8%, compared to the 11.8% in the U.S. As of May 2020, Clark County has a 29% unemployment rate and 85.8% of 89101 residents receive SNAP benefits. Also in Las Vegas, 29% of the population is on Medicaid or Medicare. The region of 89101 has a food insecurity percentage of 20.2%, which is the fourth highest percentage in Clark County as of 2017. According to the census, 22.6% of the Las Vegas metro area speak Spanish. High school graduation rate in 89101 is 63%, and 8% of 89101 population has a bachelor's degree. The dropout rate in 89101 area is 35%. There are multiple elementary, middle, and high schools in the 89101 region. 87% of the student body of these schools are minorities, mostly being Hispanic. After thoroughly researching our aggregate, we found the following 3 concerns: language or communication barriers, lack of education, and high rates of poverty. According to the most recent census, 22.6% of the Las Vegas metropolitan area speak only Spanish. As for education, only 63% of the population in 89101 graduated from high school, and only 8% have a bachelor's degree or higher. While there are multiple elementary, middle, and high schools in the 89101 region, majority of school populations in the area are minorities that do not speak fluent English. In comparison to other states, residents of Las Vegas make an average of $3 an hour less when it comes to hourly wage. And while the unemployment rate for the United States is at 11.8%, here in Nevada it is currently 29%. Additionally, 85.8% of residents in the 89101 region receive some form of government assistance, and there is a food insecurity of 29%, which is the 4th highest in Clark County as of 2017. It is these combinations of determinants that have allowed the current pandemic of COVID-19 to take such a toll on our aggregate. As of August 5th, 2020, there are a total of 1,335 COVID cases in the 89101 region, making it one of the communities with the highest incidences of COVID, which is why we felt we could make the most impact on our aggregate by providing COVID-19 education and resources. Our nursing diagnosis is increased incidence of COVID-19 among the 65-plus population in 89101, related to decrease in knowledge and language barrier as evidenced by increased number of COVID cases, education attainment rates, and Spanish-speaking prevalence within the 89101 zip code. Our main concern when addressing the needs of our aggregate was the increasing number of COVID-19 cases in that area. Other factors that influenced our diagnosis were the low high school graduation rate of only 63% and the high rate of Spanish-speaking residents that use Spanish as their primary language. With the information we gathered, we felt that preventative education was the best way to achieve our goals to help the 65 plus community within 89101. Our goal for improving the health of the population is to increase our aggregates' knowledge about the management of COVID-19 and the various resources available to them. Specifically, information regarding use of proper PPE, locations of testing sites, when to get tested, services for food delivery, and how to properly quarantine are included. Though providing education and resources for our aggregate, our goal is to ultimately decrease the prevalence of COVID-19. The Healthy People 2020 goals that align with our objectives are to increase the proportion of crisis and emergency risk messages intended to protect the public's health that demonstrate the use of best practices, and to use health communication strategies and health information technology to improve population health outcomes and health care equality while achieving health equity. In an effort to limit exposure to our aggregate, we decided to implement our educational brochure in a 3-step process. First, we'll use USPS Every Door direct mail and sort the routes by households that have 65-year-old individuals and are within the zip code 89101. The household information is based on census data of the previous year. Therefore, it will be an accurate and efficient way to reach our audience without risking social distancing guidelines. The first piece of mail that we would like to include would be a simple postcard asking our aggregate to fill out a pre-survey about their knowledge of the current COVID-19 pandemic. Using an incentive to increase the likelihood of participation, the postcard would include a prepaid stamp and promise a COVID gift bag upon completion and return of the pre-survey. Individuals will receive a small gift bag with our educational pamphlet, a travel bottle of hand sanitizer, a surgical mask, and another postmarked postcard that would include a post-survey. The post-survey would evaluate the effectiveness of our intervention. We believe that these are the appropriate interventions to take during this specific phase of the pandemic in order to have early detections and furthermore prevent the spread of COVID, as well as providing the necessary tools so that this aggregate minimizes their contact with individuals who can possibly be contagious. In the brochure, we decided to incorporate how to properly wear PPE when going out, what signs and symptoms to watch out for in order to get tested, locations where one can go get tested. We also provided the address and telephone number if needed. And finally, we provided a few resources that people in the 65 plus aggregate could find helpful if they need aid with groceries, medications, meals, and transportation to places around town. We included education on these resources so that our elderly population could reduce their exposure, thus decreasing the likelihood of contracting COVID. Our intervention is considered a primary prevention. Primary prevention aims to prevent an illness or disease before it happens. Our intervention is aimed at preventative education that addresses the educational gaps and language barriers that may be contributing to the increasing spread of COVID-19 in the area. Primary intervention lets us intervene before health effects occur, therefore increasing positive health outcomes as well as decreasing the cost to the individual and healthcare systems. Our